It's my Feel Good Breakfast Show.
And a very warm welcome back to your Feel Good Breakfast Show. Mo gaetse go itumedisa jang go itisa le wena mo your Feel Good Breakfast Show Expresso on SABC3. Tanki re a leboga siabonga ona le rona.
Well, Women's Month is almost at an end, and today in our health segment, we're talking to Dr. Darren Green about an issue that can affect 1 in every 42 women, as many as 1 in every 42 women. We're talking about cervical cancer this morning. Dr. Darren Green in the house. How are you, sir?
Fabulous, thank you. Good
very,
morning.
very good. Now listen, this is an alarming statistic. 1 in 42 women seems like it's pretty high. Why is cervical cancer so common amongst women?
Because it hides and you often don't know about it until it's so far down the line that you start developing symptoms, which then indicate that the disease has actually developed quite significantly to cause secondary effects in the systems. It's also, obviously, a lot of people don't know where the cervix is. For the men out there, the cervix is not just the neck area, the cervical vertebra, but it involves the cervix is the entry to the uterus. And it's lined with obviously certain types of skin types. And the skin type changes as you're going from outside the uterus and the cervix towards the inner part. So the cell types are different. So when that zone is put under stress as time goes on, it causes then rapid growth and recycling of these cells, as in all types of cancer, where the rate of growth is uncontrolled and atypical or abnormal cells then start growing. But we have obviously now learned that the association, since the 1970s, I think, someone described the association between a virus called HPV, so human papillomavirus, and as a cause or etiological agent in terms of this cervical cancer.
Can I ask a question really, really quickly? Now, you know what scares me is the word that you said, not a lot of women know that they actually have it.
Correct.
What are the symptoms, though? Like, what are the things that are going to make us sit up and say, uh-oh, something's not right, I could potentially have this?
You're not going to know unless you go for your routine testing in advance. In other words, there's a reason why your doctor or your gynecologist or your GP advisor is going for a pap smear, which everyone fears because of the intimacy involved and obviously the examination. But what that actually shows is it gives you a precursor warning to what's going on with those cells at the cervix and at what we call the transformation zone. And that is what then warns you that you need a follow-up within a year. If you're HIV positive and you have that association, there's now a strong association between the two, that you need, for example, a biopsy to actually grade the changes and then treat it. Far down the line, you might get things like recurrent infections, offensive discharges, but also then obviously pain, deep-seated pain, redness, swelling of the area. And, you know, those are the late signs.
And in the first question, you referred to the secondary effects of cervical cancer.
Yes.
What exactly are those, and what are some of the other complications that it can cause in the
So the cancer can either be local, at the cervix, which is the neck to the uterus, really, or it can spread. And that means then get into the lymphatics, obviously then what we call metastase, or, you know, where it spreads to the lymph nodes and to other organs like the liver, the lungs, etc. And that's when you can develop then symptoms of severe weight loss and other systemic signs of destructive tissue or cancer cells in the lung or the liver, etc. So, yeah, those are the systemic effects, and that would be then a far developed cancer that spreads. But it's a very slow progressive cancer, and everyone is exposed to it. And a lot of people don't know how you get it.
That's
Great
the
question.
Yes.
So it's spread via contact with the genital areas. So an unborn baby, for example, as it moves through the genital canal and is born, is also exposed to HPV, and thus the emergence of the HPV vaccine that we use worldwide, that's now been given in schools as part of a program to prevent cervix cancer, is given between the ages of 9 and 45, worldwide. In Australia, both boys and girls are getting the HPV vaccine due to exposure to HPV, obviously at some or other stage of their lives.
Listen, we've got a caller on the line, Dr. Darren. Samantha, good morning to you. Thank you so much for your call. How are you?
Fine, and you?
Excellent.
Thanks,
all right. So what is your comment or your question to Dr. Darren?
Okay, so my question is, I've just had my second left operation as they found a very high indication of my HPV, which is now precancerous cells. And the report came back now saying that there's still a low indication of precancerous cells. My doctor told me to go back in 3 months' time to see if we need to do a hysterectomy, but it concerns me that these cells are still present. And I'd like to know, should I not consider going for the hysterectomy now?
Yes, so she makes a very good point.
Yeah.
So these lesions, in terms of the abnormalities in these cells, these cancer cells, are graded as low-grade changes or high-grade changes. And depending on your total health picture, whether you're HIV positive or not, all that will then indicate when you need to follow up. If you stage the cancer past the stage 1, in other words, a stage 2 or 3, you'll then have, for example, in certain settings, surgery indicated and a radical hysterectomy, where they obviously remove the uterus. If, however, the cancer is spread to regional areas and so forth, then you go chemoradiotherapy.
Okay.
So it's very important. The exact pathological classification that she describes needs the 3-month follow-up and so forth, and then she can discuss, obviously, her anxieties around that with a treating gynecologist and take it from there.
Sure. Well, we are taking your calls and your comments on your Feel Good Breakfast Show. We're talking about cervical cancer this morning. If you have a comment or if you have a question for Dr. Darren Green, why don't you give us a call on 08391 33728. This is something that affects as many as 1 in 42 women, so it's real. It's something that we have to deal with every single day. And like Dr. Darren Green said, it's something that we probably don't even know we had it if we do have it. So we have to make sure that we go and take those regular checkups. But we will be continuing this chat a little bit later on our show as well.